Welcome to the Nutrition Collaborative podcast, where we cut through the noise, bust the myths, and bring you nothing but truth about health, fitness, and everything in between. I'm Alec Moore, dietitian, and each week we'll dive into what really works when it comes to achieving lasting health and fitness. No gimmicks, no BS, just real talk, real success stories, and a holistic approach to living your healthiest life. Whether you're here for practical tips, inspiration from real client journeys, or just to find out what's actually worth your time, this is the podcast for you. Let's break it down, get empowered, and focus on what truly matters for your health. And we're off. So today, we're diving into a very important topic that has definitely come up over in conversations with friends, with family, with clients, of course, and also myself. And I was actually just talking with a patient of mine this morning who has been kind of dealing with the same type of situation. And I told her a story about myself and my own situation when it comes to advocating for myself and not being, I guess, understood or well communicated with when it comes to like doctors and specialists and things like that. Now, before we even get into this, I want to be clear here. I am not here to bash any doctors, any specialists, nurses, any professional, any provider. I'm not here to bash them. This is a recommendation to advocate for yourself, no matter what the situation is, whether you're going to the dentist, the eye doctor, you are going to be going into maybe a long-term care setting for those who are older, your just regular doctor visit or something that's been lingering in your health for a while now, but you might get brushed off by a specialist, or you might get brushed off by a family doctor. You may not get the attention or time or energy that you feel that you need to get said condition or whatever you're experiencing under control and in a better state for you, your health, your wellness, and so on. So this topic today, this episode is all about advocating for your own self on your own health and wellness journey and how to do it with your own voice. Now, this does not mean, like, advocating for yourself does not mean, I'm not saying to be like combative or, difficult with the doctor or whoever you're working with. I'm definitely not saying that, because there's a difference. I'm not saying you have to be difficult or combative or reactive to them in a hasty way. It really just means being involved and not just super passive when you go into an appointment. Like passively, yeah, I've been dealing with this, and this. Doctor says, okay, have you tried this? No, okay, try that. Here's this medication, try this. We'll see you in 3 months. That's a very common visit. Instead, maybe you could say, hey, no, like this just does not feel right. I'm 38. This has been going on for 4 years now. When I turned 34, I started experiencing this, and it's only gotten worse. It's progressing. Okay, that is going to get you a lot further by literally just saying those words. They may continue to try and brush off, but then you can say, listen to what I am saying, right? Just be involved, be active in the conversation, and tell them your situation. Now, you could also sit there and be like, I'm not trying to go against your word, doctor. I'm not trying to act like I know more than you. I am not trying to, make this a bigger deal than I feel it is. But this has been recurring. The severity of it is higher than it used to be, and it's impacting my daily life. It's impacting my quality of life. And I really want to get this, to the bottom of this. Can you recommend anything yourself, or can you send me to a specialist? Can you refer me out to maybe someone a little bit more functional, a little bit more holistic? Being involved, be proactive with the conversation. Again, not dismissing what they're saying, not being difficult or reactive to them in a hasty way, but just to get the ball rolling for something more productive for you, to get better outcomes. That's it. A lot of times you'll hear like, oh, it's probably just stress, or what you're experiencing is very common. It's just because you're on birth control, or it's just because you're taking this medication, or it's just because you need to learn how to do this. There's a lot of those out there, and sometimes they're right, sure, but oftentimes they miss the mark. It's just health and wellness, holistic health and wellness is just not a one size fits all. It's not blanket statements and terms. You have to be involved on a one-to-one connection for significant outcome differences or significantly different outcomes. So just because your symptoms are common and other people who are going into that office kind of report the same things, they could be coming from 20 different root causes. And so we should treat it that way. We should circle all the way back to the beginning of the root cause. And I've talked about this in previous podcast episodes as well. So another one is, I hear it a lot, is blood work. They'll give a very, very wide standard reference range or reference interval for what is normal. And they'll just, brush you off and say, yep, your labs look good. But they won't dig a little bit deeper and look at, well, actually, you might have a B12 deficiency. And I don't really like seeing, I really don't like seeing, your A1C at like a 5.4. And I mean, look at this over here. Look at DHEA is tanked. Look at sex hormone binding globulin. Why is that on the upper end of normal? It looks like your sex hormones are tanked, but they're all bound up in globulins, proteins throughout the body, just not free roaming. So you're not utilizing them effectively. How can we fix that? How can we be proactive? How can we take a step forward with that? How can we be involved? Not just, oh yeah, they're in the standard reference interval. It doesn't, the automated machine didn't red flag it, so you're good, you're golden, everything's fine. That might not be the case. And this is also I'm not fear mongering. I'm not trying to scare you and say that there's some mystical thing going on in your body and you need to, panic every time you go to the doctor for labs. I'm not saying that. I'm just saying be okay, be willing to dig deeper because you're going to have to. You know your body best. No one else does. You know what you're feeling. You know what you used to be feeling. And not everything is a condition. Not everything is a disease. Not everything is an illness. You may just need to improve the structure of your nutrition and all that stuff will get better. I want you to walk out of there with answers and with direction, not just, well, that's normal, so you're doing great. Keep doing what you're doing. You may be at the brink of falling off the all of those intervals and be really close into just disaster, right? So again, this is not fearful. I'm saying fearful words there, but that's the reality is that if you just ignore it and just because it's in standard normal reference, range, it doesn't mean that you're optimal. It does not mean that you're in an ideal state of health. And it does not mean that in 3 months, it'll look the same. So how can we really go about this? I would say the first thing is ask questions, be curious. If they can't answer them, then you ask for someone who can answer them. Not all doctors are, not even myself, right? We're not going to have all the answers, but I'm much happier if instead of making up an answer and making the client think I know everything, saying, you know what, I don't know the answer to that. I'm going to send you to someone I know who can answer that for you. Or I'm going to go dig deeper myself and find an answer, solution, resolution, whatever for you. So questions, and then second opinions. That's always third opinions, fourth opinions. I've done the same thing for for one same thing, but getting 3 different answers from 3 different professionals. So a lot of times it's the discretion of the provider, or the discretion of the professional to make that clinical decision. So it's not just you have this. It's not black and white. You don't just have this and we do this. We could do a number of different things depending on who that professional is and where they're kind of seeing, where you're at on the journey and what's kind of reacting with what and what's causing what to happen. So on top of asking questions and getting second opinions, you can also bring data to the table. Say, look, I've got a symptom tracker for you. Instead of you brushing me off saying it's normal, does this look normal? Does my hair falling out every night feel normal or sound normal? Do these symptoms at a 10 out of 10 severity look normal? Is that common for years? So bringing that data to the table. So food logs, although they're not going to be really well trained in nutrition, but symptom trackers, sleep scores, sleep tracking, whatever data you have, maybe it's unintentional weight loss or maybe it's unintentional weight gain. You can say, look, I've been eating the same thing for months on end and my weight is flying up. So tell me again, doctor, that my thyroid is fine. Here's a genius question. Actually, another thing is saying no to recommendations that you might not feel aligned with. You might not feel you might not feel great about. You might not feel comfortable with taking that medication, or you might not feel comfortable with what's going on and saying 3 months? I don't know what's going to happen in the next 3 months. I really need to get this checked out now. So a couple of phrases here I'd like to share with you that might help you on your journey. Can you help me understand why this is the best option? So an explanation for, or a reasoning for what their action is. If that doesn't feel right for me, are there any alternatives? That's a really big one. So if you might not agree with what they're doing, are there other alternatives that you might recommend for someone who just doesn't agree with that or doesn't want to follow whatever they've given? And again, it's not to go against that doctor, but it's just what you feel most comfortable with in that situation. It's opening up the conversation to explore other options, routes, paths, modalities, you name it. Here we go. Because it's your body, it's your brain, it's your health. You're not overreacting. Unless you're screaming at the person on the other side, you are participating in a should-be collaborative health journey. But oftentimes, it doesn't go that way. What other approaches could we consider, right? So a couple of ways to go about it of, okay, that's great. Thanks for the recommendation. What else is there? What else could we do? What else would benefit me, you think? Morning sunlight, regulating my circadian rhythm, regulating my bowel movements, eating proper fiber. There's a million other things out there that you can do for your health that might actually get you feeling back in check without having to go down that path of medication or implementation of whatever their protocol might be. There are, this is a good one here. There are many, many, many ways to go about one condition. Okay. So let's say you have PCOS. You may go to the doctor and they may say, you know what, in order to get, so your PCOS tendencies or PCOS symptoms under control, let's put you on birth control. Go lose some weight and get put on birth control. This is not uncommon. I've literally heard this multiple times in just the past few months from doctors working with my clients. It is a real thing. I would not be making that up. So that's a scenario. But say then you see a functional provider on the exact same topic and they say you may be given, or they may say you need these 6 supplements and then told to cut dairy and gluten. You see a fitness coach on this topic and you might be told you just need to lift more weights and do a reverse diet of some sort. So are any of these 3 things totally wrong? No. But are they completely drastically different in their actions? Yes. But on their own, they are incomplete of the holistic, bigger picture. So you need to work with someone who is well-versed in these different areas and can think outside the box and not just in their one little scope, confined in this tiny little box where it's just protocols, one-liners. Oh, you've got PCOS. Okay. Beep, boop, bop, 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 calculating. I'm a functional doctor, so you need these 6 supplements. I'm a fitness coach only, so you need to lift weight, do more cardio. It's going to be whatever they're specializing in. So you need someone who can piece it all together, that understands anatomy, physiology, biology, chemistry, you name it, and nutrition itself, and how the body works with all of those things together, not just in this one specialized way. So one of my biggest recommendations is tracking your symptoms, patterns that you're noticing with your health, and basically become a student of your own body without hyperfixating or ruminating or becoming obsessive. Because then every little thing feels like it's this big thing. And that's actually a previous episode. Actually, I think it was last week. We just talked about it, about not allowing your condition to be your identity. So seek out professionals who collaborate, not just dictate. Trust your gut, because if something feels off, it very well likely is. Your labs aren't perfect. You end up feeling like garbage. There's got to be something going on there to lead you to feel that way. And maybe labs are showing you're in normal ranges, but maybe you need to do a little bit more hormonal testing, a little bit more gut testing, or a little bit more symptomatic tracking to dive into that bigger picture on a more holistic level. And so if someone doesn't respect what you're coming to them with, your questions or your boundaries, or you're probing for more answers, you are allowed to walk away and you're allowed to go get a second opinion, third opinion. You're allowed to find the right coach for you or provider for you. They should not feel threatened by your questions. They should welcome them, hear them, listen to them closely, and want to help. That is the professional. That's why we as health professionals got into this space, is to help people, direct people, lead people down the path of better health, not or cause and effect. Okay, here's action. PCOS, okay, same thing. Weight loss, same thing. There has to be more critical thinking involved on a deeper, holistic level, because you deserve to feel heard. You deserve options, And you also deserve to be provided with the reasoning behind why someone may be doing something to your health or for your health. Explanations. This is not like rejecting science at all. It's just caring for yourself, and that there should be no shame or guilt in that at all. So don't be afraid. I know a lot of people will be like, well, I was scared to like say something, and at the doctor's appointment, he made me feel rushed, and like he had to go to the next room for the next appointment. It's like, okay, then ask him on the way out, where can I find more help? Who do you know in your network that will help me on a deeper level? And if they can't find anything, walk out of the office and never come back, and keep searching, keep hunting. So if this episode hit home, I do want to hear from you. So DM me or tag me in a story talking about how you've had to advocate for yourself. I want to hear it. And you don't have to get super specific, because obviously that's public, but with your health information. But I would love for the world to know more about advocating for themselves and how to do it. And then hear some stories about real life examples of others experiencing the same situation, but then advocating for themselves and flipping that script for themselves. Because even myself, I'm not going to go down the story of, myself, but long story short, got an EKG last year and it came back abnormal. And I've been trying to call, email, connect with the doctor who wrote the test. Cannot get a hold of them with calling, with emailing. It's 45 minutes away. So I'd have to go, drive across Texas just to get there, just to talk about something that could be a phone call. And they just keep sending me the invoice from that appointment last year. And it just doesn't feel right. Like, talk to me about what is going on. I've asked you. I've been proactive. I've been involved. I'm participating on my end. Why are you not on your end? Why did we even get the test done in the first place? It's just wild. So if you know anybody who's navigating, confusing symptoms, dismissive doctors, or just feeling stuck, send this their way. Okay. So send this their way, or tag me in a story talking about, a moment that you had, where you had to advocate for yourself and it changed the game for you. Because I really want to normalize being an active participant in your own health, starting yesterday. So your health and your voice both matter. So that's what I've got for you this week. I hope it helps. Let's continue changing the world. Thanks you all for tuning in, and I'll catch you next week.